The second wave of COVID-19 has thrown up a lot of questions. All of a sudden, people are discussing CT values or cycle threshold value. Well, as an expert would explain to a layman, so that is why I would want to speak to Dr. Samiran Panda, who is the head of Epidemiology and Communicable Diseases Division at the ICMR, the premium body of the government to decide these things. So thank you so much for speaking to us. First of all, what is a CT value? Why are people talking about it, questioning it now? And what is the relation of the CT value with COVID-19 infectiousness?
Well, as you said, CT value stands for cycle threshold value. And this is related to RTPCR test. Everybody knows now RTPCR test is a test which helps us to diagnose somebody if that person is infected with the virus SARS-CoV-2 that causes COVID-19. Now, in RTPCR test, you need to run a few cycles. So the samples, the clinical specimens that we collect for testing in this particular disease or suspected infection is nasopharyngeal swab or oropharyngeal swab. So those swabs are used as clinical specimens before we go to the laboratory and extract the RNA and then run the RT-PCR test. This is an RNA virus, so you need to extract the RNA and then run RT-PCR test. In RT-PCR test, if the viral load is high, you need not to run many cycles. Even with a very fewer number of cycles, 13, 15 or 20, you will get a positive test result. However, in a disease situation or in the specimen that I have collected, the viral load is low, then you have to run the cycle for quite a few times before you get a positive result. So the CT value has an inverse relationship with the viral load. If the viral load is high, then with low cycle run, you can get a positive test result, and naturally their CT value would be low because you have run 15 cycles or 20 cycles.
Right.
Now, if you lower down the CT value, saying that with 25 or 24 CT value, you can detect somebody as positive, anything above it is to be considered as negative, that would pose serious problem. Because the person is still infected, the person had low viral load, however, you would not be able to detect him or her because you ran lesser number of cycles. So the person would be given a test result negative. So he or she would think, I'm not infected. So although he or she gets some illness or symptoms, then he won't care much in order to go and seek treatment. That's one aspect of it.
Right.
Because you have missed out an infection. Moreover, that infected person who was declared falsely though as negative, so it is called false negative result, would be able to transmit the infection to many others in the family and in the society. So basically, we cannot have a general rule of 25 or 24 as a cutoff, above which I will declare anybody and everybody as negative. That would be a wrong practice.
So, but what was the logic of the Maharashtra Health Department wanting to look at the CT value of 24? What is the logic behind it?
That would be difficult for me to answer, but I can only talk about the science part of it. So most of the RT-PCR kits and the manufacturers who produce, there are different manufacturers. So 35 to 40 is the range in which you should detect somebody as positive. Anything above 40 should be considered as negative.
Right.
So why suddenly this decision? Because that is not a very prudent public health practice, I would say, if somebody decides that let us bring down the CT value. So that will be able to capture all the people who have high viral load because they won't require that many cycles. So within the low CT values they will be detected. However, many would remain undetected, they won't seek treatment. From them, others could get infected. So it won't be a very prudent public
So
health.
if I say that those who would have a slightly lower viral load would also be infectious cases,
Yes.
and they can spread the infection. That's what you're saying.
Oh yes, absolutely. So the viral load might be low, but at the time of talking or sneezing or coughing, the water droplets or the infected aerosols that will go, if I'm infected, from me to others, would be able to spread the infection. So that won't be a very good thing.
Okay, doctor, why should I as a layman worry about the CT value, or should my doctor worry about the CT value? Why should I look at my test report and say what my CT value is? Should I care about it apart from the scientists and the microbiologists who are talking about it?
Well, knowledge is power. So basically, if you know that your CT value is low, then you know that your throat or the nasopharyngeal swab or the oropharyngeal swab that was taken from that individual who finally came with a positive result and a low CT value had high viral load. Okay. But it does not necessarily mean that the person would be also terribly sick. That's not true. So if I have high, viral load, but I am not having symptoms, I need not to go and get myself admitted to the hospital. I can still be in home isolation, but I keep a check on my own health. And with the pulse oximeter, if you keep on having a vigil on the oxygen saturation, then you can really consult your doctor as and when necessary. And doctors, of course, can make clinical decisions in terms of high viral load, and then clinical examination and the clinical signs and symptoms would help them to take treatment-related decisions better.
So test reports must continue to show the CT value number to the people.
And even if it doesn't show, then one has got every right to ask from the laboratory that what is the CT value. Because CT value would be generated anyway if somebody is running RTPCR. Yes.
So based on that, the doctors can take a decision whether or not to ask them to isolate at home or admit them to a hospital,
And of
right?
course, it is not just the value. You are absolutely right. So CT value is one of the clinical tools which would help the doctor to take a decision in conjunction with the clinical symptoms.
So currently, what is ICMR stand on this? Should we follow the practice status quo as what the WHO has also recommended?
Yes, we have the advisory which is in the public domain and on the ICMR website, which clearly says 35, and manufacturer to manufacturer variation goes like 35 to 40. So we still stand as per the advisory which has been made available to the public.
Well, that was a very clear, lucid explanation of what exactly is a CT value and why you should be worried about it. You can ask your test provider to give you the CT value and then consult your doctor before taking forward any treatment if you're found to be positive or negative with COVID-19. But for now, I think the doctors and the scientists and the microbiologists should be left to look at the CT values, and one must just continue to follow COVID appropriate behavior, wear a mask and social distance themselves. With Nasir Khan, this is Milan Sharma for India Today.